A warm welcome to all our viewers to our series Natural Medicine. It's a great pleasure for me to have a doctor here today. He's a doctor of natural medicine, is a doctor of integrative medicine, and is Dr. Ludwig Reiser. Welcome, dear Ludwig. Thank you. You're welcome. I know from information that was brought to me that you are one of the pioneers in the field of light therapy. You've been there from the start. And I'll be interested in your story, how it started, how you achieved success in treating patients. I'll just let you talk a little bit about it. Well, then I have to start at the very beginning. I was interested in light medicine because it was already clear to me through my educational path that ultimately cell communication happens with light, that the entire structure of matter is with light, so the whole energy system of a person begins with light. So no life without light, no life without light, it's just a fact. And that's why it's also trivial that light and vibrations in general, of course, can also have a very positive influence on our human body. Oh, I can talk about vibrations with you too? Of course. Great, well. And that's how I started to be interested in light medicine, and then came across the Repuls company in Vienna. And I started there with still very old equipment that had frequency-defined lights. It was more about convalescence, so about the restoration of good health. And after I had a lot of fun using these devices and had also good results and got on very well with the Repuls company, then Brigitte Rumpel, the developer in the company, gave me a prototype one day and said, "Give me some feedback. It's built for inflammation." This is how it all started, and inflammation is actually part of every disease process. That's why I just use it with all inflammations that I've come across. Tried it out, and since in my practice the focus has always been on oncology, of course I also had many oncological patients and started treating individual pathologies with this first prototype. That was still very exciting because the cables were still peeking out and that wasn't a finished therapy device, but actually a circuit board with this nice lamp on the front, and it worked great. And so I was permanently hooked. And never let the subject of light therapy out of my treatments, out of my therapy concept, so that it has been preserved to this day. Well, for me, this is relatively new. I've now heard it for the first time from Professor Schickow, who did a lot of research about it at the University of Vienna. And that actually nowadays, many hospitals in Europe already work with this technology. But as a consumer, I didn't know that I could actually have such a medicine cabinet also at home. And that's why it's so important to me to document this topic. Yeah, that's a very good point, something like a medicine cabinet. That's what I love about the light. You don't have to take anything, you don't have to inject anything, you don't have to pay attention to the dosages. All of these problem points, for which I would need a specialist, so a doctor, for example, usually don't apply to light therapy. I've never seen a case in my entire career where light therapy had negative results. So in this respect, for me, this is one of the forms of therapy that really everyone can use freely and easily, and above all can use it with a clear conscience. So the best example, if I may briefly mention this from my private life, I have some children myself, and there are 4 of them. And with 4 children, you always somehow have a child who has something, be it an otitis media, be it a bladder infection, be it the knee scratched, or it doesn't matter what. And that's why I got one of these devices at home with my children. Now, the second, because they've already worked through the first after 7 years, that is in constant use, and that's why I liked it so much, that even the children are always the best parameter for me. When children do therapy independently and voluntarily, then it's good, because they don't voluntarily do anything that isn't really right for them in balance. Tell me that when I put food supplements on the table for my children, they won't swallow anything anymore. Swallow tantrum. The swallow tantrum, exactly. But I now know from the studies that especially with pain, the pain is reduced extremely quickly with this form of treatment. Is that why the kids are using it, or something else? No, that's not. I would say, because just as inflammation cannot be compared with one another, neither can pain be compared with one another. And there is pain that has other qualities. There's no need to compare a migraine, for example, with the pain of cystitis. That's absolutely not comparable. And in this respect, a therapy effect is ultimately not comparable. In my opinion, I have a positive effect in all aspects, which is distinctive. So, acute inflammations like this, let's stick with this often mentioned cystitis. It's just such a classic. This is something where light really helps extremely quickly, where there are many positive properties that light brings with it. For example, that it reduces certain germs, that it specifically strengthens the immune system, that it builds up the whole organ from the energy balance and so on. And if I use something like this with a really acute inflammation, then of course I have effects very quickly, that's clear. In the case of chronic issues that sit a bit deeper, that have taken years to arise at all, in my opinion, it's a completely wrong expectation to say, I'm now doing therapy and it has to give results in 5 minutes. It took 10 years to come and then it should be gone in 5 minutes. Only anaesthetists can do that. But it just has an overall systemic supportive effect. And that's how most of the pain goes away. I would almost like to say all pain, although there are always exceptions. It's like that. In my opinion, there is nothing that always helps, but the light definitely has an extremely wide range of uses. What I still don't understand, I once learned that every inflammation, every pain, every illness actually comes from an acidic environment. Almost every, let's put it that way. An acidic environment is characterized by a lack of electrons. So, now I'm giving in the light. What's in this light? That's cold light, it's red light. What kind of energy is in this colour to fill up these deficits? Thank you for this question, because it shows a fundamental problem. We're looking for a substance that has a material effect, and when we talk about light therapy, then we have to think differently. Are we talking about vibrations? Then we're talking about vibrations. We're talking about vibrational effects. We're talking about energy balances, and they should be viewed a little differently. So I can't say that there are some particles in the red light that would replenish something in the body, because that's not true. It's light. That's not how it works. There are no electrons in the red light, that an energy transfer takes place. No, it's a pure form of energy. Light is pure energy. And there are many frequencies of light. Let's go back a bit further when we talk about light. I would like to show very briefly a little bit about the differences. We have many frequencies of light, and most light frequencies are actually only pleasant for us to see something. We need them for visual perception, but otherwise they have no great effect on us. But some frequencies of light have very clear effects on us. Take, for example, the most mundane, UV light. It's a frequency, a form of energy that touches us, and then we tan. It's a direct physical response. But not every light does that, only UV light does that. And now with the Repuls, with this cold red light, we have a very special frequency, which meets a certain behavior in the cells, and thus contributes to regulation. So, if I can explain that a little more intensively, we have day and night, for example. Night is darkness, day is light, is the energy, is the action. That means just this rhythm between light and dark makes our body regulate itself energetically. So at night we calm down, we go into rest, we go into regeneration. And when the light comes back, we come back up into action, into power. And so if I take this cold red light now, then, so to speak, it compensates for these voltage deficits in the cells. So that means if a cell needs more regeneration, then this form of energy goes in the direction of regeneration. But if I need more action, the whole thing goes in the direction of action. So at the end of the day, it's a balancing act that you do with it. Is that the reason these devices keep blinking? There are several reasons for that. Then we get very deep into biochemistry and the inflammation mediators and the whole inflammation chemistry. Professor Pop would be the right person to ask these questions. He knows every last detail. Fritz Albert, exactly. I have read some of his work, and I have to admit I didn't understand all the details because at some point the biochemistry simply becomes so highly complex that at some point I'll just reach the limit of my knowledge. So I couldn't explain the exact mechanism that way. I can explain what I have seen in my patients, so what is really immediately tangible to me. And these are simply more these regulating, balancing effects, this cooling down of inflammation, which in itself, just from the basic rhythms, makes absolute sense. If I now imagine a viewer who's, for example, very badly plagued by rheumatism, and they would now work with such a device, or on themselves, what can they expect when they start to use this device regularly, 2 or 3 times a day? I think the best phrase about what to expect is a journey. Because it's not the case that the Repuls can now simply be used for knee pain, for example, or only used on the knee for rheumatic knee pain. It's true, it gives me local relief, it reduces local inflammation, it'll take the swelling away a bit, that's all great. But besides, I have a lot more potential that has not yet been used. For example, with rheumatic issues, now I get to what you mentioned earlier, with the acidity, with the hyperacidity of the metabolism. There are organs that should compensate for that. The kidneys, the liver, the lungs, and these organs too are to be built up in all of their vitality and all of their basic energy through the Repuls. And then there's an almost trivial consequence if I now build up the kidneys, for example, and then of course drink enough so that I can get rid of my acids much more easily. If the kidney is now a weak organ, in Ayurvedic we speak of a cold organ, if the kidney is too cold it won't get the acid out, but increases all inflammation. That means if I only work with the light on my knee, then I'm here at the local end results, on the battlefield so to speak, but not where the fight was caused. At the cause. Exactly, and that's what I mean by a little journey. When I started with Repuls, I always went into the self-experiments and then found out, for example, that if you irradiate your liver, you fall asleep pretty quickly. Because the whole liver metabolism is activated and then you just go to rest. That would be the solution to many sleep problems. Yeah. I just read a study in Munich that 80% of all Munich residents have problems sleeping. Yeah. It's crazy. That's crazy, but there are many other reasons why Munich doesn't sleep well. Okay, but it would be a solution if you just used it on the liver, which acts to help you sleep better. Yeah, and that's where the journey begins. Everyone has a different set of problems. So I always worked in my practice in such a way that I didn't look at the diagnosis at the end, like they have MS or cancer or something, but that I tried to understand the human being as a whole. That means I have a person who has these psychological problems. They have these deficits on a purely biochemical elementary level. They have this organ quality. In other words, some organs are too active, others are too weak, and so on and so on and so on. So everyone gets many, many categories. And with that, a problem is no longer just at one point, but it has connections in all areas of our being. Whether this is our psyche, whether it's our body, whether these are our emotions, it doesn't matter. But every physical problem has arms in all directions, like an octopus. And that's what I find great about something like light therapy, that with just one technique, I can cover several of these octopus arms, and thus simply have a very constructive influence on the overall system. Now, the next question comes to me. I mean, basically, I'm interested to work on the effect, so to reduce the pain, to accelerate the healing of wounds. But if that is not the cause at all, but only the effect, I should actually have to work according to a certain scheme and say, okay, I'll start with the kidneys and the lungs or the liver, to ultimately carry this energy out? Or how do you do it in practice? In practice, my patients have the advantage that I can simply diagnose them completely, and then, using certain diagnostic procedures, simply tell people that the kidney is weak, for example, the right or the left, and I go to one of these organs specifically. Yeah, that's the advantage of having a doctor or a therapist who's able to differentiate that. If that's not the case, then everyone has something that helps tremendously well. In my opinion, that's the best doctor there is. That's your own doctor in here. That's the so-called gut feeling. When you start doing things like that, you can also just experiment. We have been brought up in our social medical thinking in such a way that if I have a problem, I don't think about this problem on my own, but go to someone who can help me. Doctor, naturopath, whatever. Hand over my responsibility there, get a prescription for whatever drugs I take, and then the subject should be settled. It's an absolutely legitimate principle, yeah, and helps the machine. For my part, I would say that I'm much more than a machine. I have other aspects as well. And these other aspects can neither be understood nor treated in this way. Only I can actually see them. When I go to the doctor, I don't have time to tell my family story for 2 hours. I don't have time, and the doctor doesn't have time to listen to my emotional ailments. But by this, you could figure out what organs are then weakened. The patient knows this best by far. And when they then begin to embark on this journey and just work experimentally. So say, okay, my knee hurts now, but in addition to the knee, I'm just treating my pulses to strengthen the vitality of my blood, so to speak. Or I go straight to the spleen to activate my immune system in general. Or I go to the intestines and the kidneys to reduce the acids, and so on. Or reducing all of these secondary inflammation factors, which extremely often originate from the intestines, then one often has the effect that, for example, the pain in the knee subsides, although I've not treated it at all, because I was only on my stomach and reduced the inflammation mediators that were caused here. And with that, the level of inflammation in the whole body collapses. This may also make the knee pain go away. If not, I'll just have to go for it separately. But that's what I mean, that for me this light therapy is definitely medicine for the future because it's as cost-effective as possible. I have it. Once I have the light source, then I never have to buy it again, so to speak. It's no longer a drug that I'm running out of. And it's just easy. Anyone can do it. You can't go wrong with it. For me, this is absolutely a future-oriented, therapeutic, scientific, medical direction that we should actually all be going. And I think it would also provide maximum relief to family doctors' practices with all these small and big ailments. But there we talk about a new medical society. And we can talk about it again in 10 years. There is a great movement there, but light therapy is being researched. Also, the University in Vienna does great research in the field of light therapy and especially pain and wound healing. That's what I've been told. But it's still a medical device. So can I as a consumer buy such a product without any problems, or do I always have to do it through a therapist who trains me and tells me how to use it? Well, I have to admit that I don't know the sales channels of Repuls, down to the last detail. I have the advantage, I have a practice, and of course I get my equipment directly from the company. I give them to my patients on loan. I also know that the devices can be rented directly from the company. And I am quite sure that everyone can simply buy them there directly. Well, it would make sense for people suffering at home now, just to test it, right? I mean, they're not doing anything wrong. Yeah, you can certainly rent the device, you don't have to buy it right away. You can test it for 3 months and see what happens. Exactly, but then the important thing is that you have the right expectation, that you also understand that we are more than just a local problem. And when people go on a journey, as I called it earlier, with something like that, then I think 3 months is absolutely enough to find your own personal way and to find out whether it suits you or not. Absolutely, yeah. I used to talk about the magic 3 pillars, that water, air and nutrition should be regarded as medicine, as basic medicine. Of course, there's also the spiritual soul component, but today we actually have to inevitably add light, because without light, there would be no life at all. But we can then make that word general vibrations instead of light, because whether it's artificial light that burdens us energetically, or whether that's now specific frequencies for mobile communications or electric smog, it doesn't matter in the end. They are all vibrations, just like the light, that triggers specific reactions in us. Some damaging and others healing. I feel that I could talk to you about quantum physics and still learn a lot about it. Yeah, quantum physics, I would be happy to come to that. I think it's a very important topic because that's a new research picture, which I think revokes all physics, or turns it upside down. Not revokes it, but turns it upside down. I would say broadens it. We just see through this quantum physical thinking that it is also the reason why I studied integrative medicine, because it complies with my conception of being. What I've learned so far was not complete enough. It was too material. So I loved being in the laboratory. It was all very analytical. But these personality aspects and these aspects of consciousness were just left out, because when you do a lot of oncology, then you keep seeing these little miracles in between, that you actually have a hopeless case who then might even abort therapy and is completely healthy 6 months later. Yeah, so cool. You experience this, and when you experience that, you say, okay, purely material, purely medical, it's incomprehensible. So maybe it's a miracle. Well, I can check it off, but I've seen too many miracles for that, so there must be other mechanisms that tower above what we think the world is like. And for me, that's very clearly the consciousness, that it's for sure our inner attitude, our consciousness, which actually makes up everything. Ultimately, this also determines our health. And now, to close the circle back to Repuls, to this journey, what I've said, if you begin to stop using the Repuls like a pill, just like pain, just go away, but you start to come into an experience, then you find out other references to yourself, such as saying that if I use it on the kidneys, my mood gets better, my sleep gets better, my motivation gets better, my frustration subsides, whatever. I've now linked many emotions to just one organ, which of course can be specifically unraveled. So when I watch TV in the evening, I just work with it for half an hour. I do something good for myself every day, even when I'm fine. Then I do something good for myself in the same way as when I take a normal medicine, because it happens without thinking about it on the side. It's very comfortable, but I don't think it has anything to do with deep healing, because if I claim for myself that I really want to get healthy, then first of all I can't just hand over responsibility somewhere and say, please solve my problem. But then I have to deal with myself. That means integrating your own consciousness into your own treatment. Exactly, and I do that when I'm not watching TV on the side and allow myself other colour frequencies and other frequencies of consciousness. But by taking the time and focusing specifically on the fact that I am adding this light, this energy that I now add to my body in a highly concentrated manner, and also use it for me, and, so to speak, I want to put it very simply. It may be a bit too simple, but it doesn't matter. That is the best way to understand it. Energy is pure light, and my brain is the addressee. So if I concentrate on it, I can give the light any address and say, please alleviate this inflammatory problem here, but at the same time, please also check my energy balance. For example, bring my motivation up, bring my sleep to a greater depth, or whatever, that you simply go into conscious self-reflection and use this device to move forward on the right track. For me, this is the medicine of the future. It includes personal responsibility. It includes awareness of it. It includes also very serious classical science. It includes very simple physics. It includes everything I need to make really good medicine. You got to me a long time ago. I understood it a long time ago. I only asked myself one more thing. How can a young, well-educated person like you with so many doctor's titles actually carry this incredible, deep knowledge and not just think one-sided, but so holistically? What you represent is the future. Maybe it was because I just had a very unusual educational path behind me. I never studied conventional, sorry if I call this conventional medicine, studied at a conventional university. I first became a chemical technician in the pharmaceutical industry. I didn't like that at all. That's why I became a naturopath. Then I studied homeopathy and then just started to study everything that interested me. And all that, what helps my patients. And I believe that this is the way to really learn to understand medicine in its entirety. Because at some point you get to the point where I say, okay, now I have to deal with hormones because I have a knowledge deficit. Then I have to deal with psychosomatics because I have a knowledge deficit there. Well, and so one after another. And I actually studied for 12 years in total, part-time, but it was just fun. You have to be made for it. Yeah, really. Thank you very much for this first educational episode in the field of light therapy. For me, it was a very valuable form of therapy, and I've benefited from your knowledge today. Again, I have a great respect for you, what you've achieved with your knowledge. And dear viewers, you can be absolutely sure that I will make many more episodes with Dr. Ludwig Reiser. You can count on it. There's much more to come. I've already heard what else he knows about Borrelia, about MS, and God knows what else. So we'll wrap it up and then present it to you. So that's it for today. Thank you very much, and I wish you all the best and see you next time.